it is time for your healthy dose of information from Hannibal Regional Healthcare System. Today we're talking home health care, and joining us here in Studio H, it's Lisa Dryden. She is a home health nurse. Good morning, Lisa.
Good morning.
How are you?
I'm wonderful. How are you?
Very good. Have you been here before?
No, I haven't. This is my first time.
That's awesome. Have you been on the radio before?
Never.
Okay. Well, there's nothing to be nervous about. We just have a little conversation here, and it's something that you totally know about because you know about being a home health nurse.
Yes, I'm actually a physical therapist, but I work very closely with the home health nurses as well.
So what is home health care?
Home health care allows the patients who are recovering from an illness or a surgery or a hospitalization to basically receive services within their home related to their medical care and therapy care. It basically, they're provided by the physician or the Hannibal Regional Home Care professionals and authorized by the physician.
Okay, so it is a situation kind of like you're talking about rehabilitation.
Yeah. So like if a patient has a decline in function or their health, we are then called to go in and assess and make goals to help them get back on their feet again.
Okay, set the goals is the thing, but you need the cooperation not only of the family, but very much so of the patient to be able to do that, right?
Yes, sir.
And you know how that goes. Sometimes you get somebody who really goes right along with it and wants to recover and is really aggressive at it. And I'm sure that you get some very challenging situations too, where maybe somebody's just not as excited about going through the process of recovery.
That is true, but most people, they want to get better. Sometimes they just don't have the means or the knowledge to know what to do to get better. And when you go in and you provide the encouragement and the education, it gives them the tools then to make the lifestyle changes to get on the right track and improve their wellness overall.
Okay, and I'm sure for you, it's a very encouraging process to see that happen.
Yes, it's very encouraging and very rewarding. I see a lot of people get better, and you really get to know them and get to know their reality because you're in their home situation.
Isn't it great when out in public or a year or two later or something, you see these people and they're just so happy to see you again and doing so well after that time of recovery? Yeah,
I love it. When I see my patients in public, I sometimes don't remember their names, but I almost always remember their face. In fact, I saw a guy last night at the gas station and he said, "You don't remember me, do you?" And I said, "Oh, I do. I remember you. I'm that mean therapist."
The one that came in and had to make him do it, get it done and recover.
Yeah, and he thought I was mean at the time, but he did say last night, he's like, "But that's what I needed, and I was weak, and you got me stronger." So
that's awesome. Good job.
And again, it's a range of different things that you could talk about, and it's important for people to do it in the home because that's the environment they're going to be in. But talk about some of the different services for home health care that Hannibal Regional offers, and some of the different ways you help people with this process.
The different services that we offer registered nursing care, physical therapy, occupational therapy, speech and language pathology, and we also offer certified home health care.
And medical social services.
Yes, yes. We also have a medical social worker that's associated with us.
Yeah, and I was talking to them. It was about a month ago when they've got that small facility now that offers some of this stuff inside of Hannibal Regional Hospital. I know they just opened up that one wing where they do the home health care there, but not everybody can do that. And sometimes it is better to be in your own home, to know that you're going to have to be reaching for your cabinets and knowing that you're going to have to be going up and down those stairs. I mean, how important is it for someone to get used to that environment again?
Right. Well, they did open up the inpatient rehabilitation facility at the hospital. But being within the home is just so real because they can't go within the hospital and walk down a 10 feet hallway or, a 10 feet wide hallway and do fine. But yet in their home, there's no hallway that is even close to half that wide.
Right.
So you get to see the reality and the barriers that they have and help them, with the modifiable things to improve what they can within their home to make it safer for them, whether that's, establishing an exercise regimen that they can do in their living room or their kitchen to pulling up throw rugs and, moving a desk from here to there so that they can get their walker through a walkway. So there's so many little things and even more big things that we can do to help them get on their feet again.
All right.
Lisa, why is home health a good option for patients to consider?
It's a really good thing for people to consider because it makes early discharge from the hospital possible. We live in an era where people aren't kept in the hospital for very long. They're discharged, and sometimes they're not even, basically, they don't meet the criteria for admission into the hospital. So, but yet they've had a decline in function and health. So basically, it allows us to come in and assess them and make goals and help them recover and get better, even despite the fact that they're not still in the hospital or weren't able to be admitted to the hospital.
Okay, once they get into that process, when are nurses available for home health care?
Our nurses are on call 24 hours a day, 7 days a week. So if a patient's having a concern or a question, they are given information to contact our nurses as needed.
All right.
So they can make a call and have a nurse come at any time, basically?
Well, yes, they can call if they have a concern. If a visit is warranted, it is made. A lot of the services, and a lot of the on-call things that we deal with is just a patient, they have a question or a concern or they haven't heard from the doctor regarding their pro times after a joint replacement, and we can coordinate for them after hours, or a lot of it just involves a phone call with encouragement. But if a visit is warranted, it is definitely made.
Okay, what medical conditions would best benefit from Hannibal Regional Hospital home health services?
There's an array of medical conditions that we treat, from total joints, which I have a lot of those right now, surgical stays in the hospital, just recent hospitalizations. And, there's always those patients that just, say a patient was fine and then they all of a sudden are having frequent falls. So there's a large population of patients that we serve and help to get on their feet again. And the best way to find out if you qualify and if it's a good thing for you is to speak to your physician.
All right. I think somebody needs you right now.
Oh,
I
no.
can hear your phone there. I think maybe they,
Patient scheduling.
Yeah, there you go. Okay. How can somebody get to information on home health services from Hannibal Regional?
Well, home health is always overseen by the patient's physician. So if a patient feels like that they would benefit from home health, the first thing to do is talk to your doctor. And they're very knowledgeable about the conditions and the appropriateness of home health. And they'll be able to steer you from there. And hopefully, if you are within our areas that we serve, and there's 10 counties between Missouri and Illinois, we'd be happy to check into that for you.
All right, very good. It's good information, and people can get a hold of you, 573-406-5780. You can go to hrhonline.org for Hannibal Regional Healthcare Systems too, right? Mm-hmm. All right. Lisa Dryden, thanks for your time this morning, and great job.
You're very welcome.
Thanks for coming in. That's your healthy dose of information from Hannibal Regional Healthcare System.